Hi, this is Meryl Moss, and I'm the Chief Operating Officer at Coastal, and I'm here today to present our second in a series of informational videos about when to go to the ER. We're very lucky because we have Dr. Anthony Napoli with us today. He is the Associate Professor of Emergency Medicine at Brown and Director of the Rhode Island Hospital Chest Pain Center. And Dr. Napoli is going to join us and talk to us about heart attack. So let's start at the very beginning. What is a heart attack?
Your heart is a muscle like any other muscle, and when a muscle is threatened and doesn't have good blood supply, you have pain. And so when the blood supply is threatened to the heart doesn't get blood, and therefore the tissues of the blood of the heart die off, and that's a heart attack.
So one of the things that we really want to emphasize today is when a coastal patient with certain symptoms should call 911 and not necessarily either call their primary care provider or the 365 clinic. So can you explain some symptoms that people might be feeling that they feel like this is when I absolutely should call 911?
Sure. Far and away, the most common symptom of a heart attack is, in fact, chest pain. Chest pain can come in many different forms. The most common is a pain, but it might be a dull ache. It might be a tightness sensation in your chest. It might feel like pressure on your chest. It might feel like a sharpness of your chest. But if you have any symptoms of pain, particularly in your chest or tightness, that lasts longer than 5 minutes, that would be reason to call 911. The pain can also come in different areas. It's not always just in your chest. You might have that same tightness or pressure sensation in your throat and your upper abdomen and your shoulders. And you can have that pain go from one place to the other. So if you get pain in your chest, it goes into your arms. Those are all some of the more common signs of a heart attack. Other less common but also important things are if you have shortness of breath. And again, a shortness of breath that feels like a tight shortness of breath. And sometimes dizziness, unexplained nausea or sweating in association with some mild chest discomfort. Those are all reasons to call 911.
You know, it's interesting because I know that some of our older patients, they don't want to bother anyone. And I've heard people say, well, maybe it's indigestion, maybe I pulled a muscle, maybe I'll just lay down. And time is important, isn't it?
Time is very important with regards to heart attacks. Heart attacks are just like anything else. Your heart is a muscle, but in this case, this muscle can die off quickly, and it's one of the most important, if not the most important, muscles of your body. So there are very good studies to show that the faster we can open up the arteries that supply the blood to the heart, the better people do. If you have any questions, call 911 and go to the emergency department if you have some of those symptoms. Don't drive to the emergency department. You lose valuable minutes getting there. You lose valuable expertise of ambulance personnel that can do an EKG, get an IV, call the transporting hospital, and get you to where you need to be.
Now, Dr. Napoli, we're giving patients a list of their medicines when they leave. It's a visit summary, and it's also on our patient portal. Should they bring that with them to the emergency room? Is that important?
Yes, of course, it's helpful to bring the list of medications that you're on when you come to the emergency department. It helps, again, it's valuable minutes that can be lost, and knowing what medications you're on, particularly if you have a complicated medical history, and particularly if you have a history of heart problems in the past, it's valuable to know your medical history, the doctors that have been taking care of you, your allergies, and whatever you can bring would be helpful.
Right, so what we're recommending is that when we give that visit summary to patients, you know, put it on your fridge, put it in a place that's available to you. So for any emergency, you grab it and you can bring it with you. What happens when they arrive? What's their ED experience or their emergency department experience?
Sure. So when you arrive to the emergency department, the first thing you're going to see is a triage nurse. They will do an electrocardiogram, which is a measure of your heart function. And if that electrocardiogram, otherwise called an EKG, indicates that there's a need for immediate action, you'll be taken to the catheterization lab. That's where they open up the vessel of your heart, try to restore blood function, and end the heart attack. If the EKG doesn't indicate immediate action is necessary, we'll take the time to get further history, physical exam, and more details about the symptoms that you're describing to try to determine if there is reason to admit you to the hospital to investigate further for symptoms of a heart attack, to investigate further for other causes of the discomfort or pain that you're having, or to discharge you back to your coastal primary care provider.
Dr. Napoli, thank you so much for being with us
Sure.
today. We take the health and welfare of our patients, coastal patients, very seriously. We want to make sure that people really understand when they should access their primary care office and when they should call 911. I think you've made it very clear that if people have signs and symptoms of a heart attack, they should call 911 immediately. They should not drive to the hospital, and they should bring the information, their health information with them. So thank you very much.
My pleasure.